Secrets in their pockets.
20-something woman, agitated and out of control. PD found her running around in the middle of the I-90 express lanes.
What's she on?
Nothing we can tell, no track marks or tweaking signs, but a lot of rambling.
Airway's clearly intact. Obviously has no problem moving forelimbs spontaneously. I'd say my job is done. She's all yours. Thank you.
Dr. Charles, treatment 3, can't wait.
Oh, man.
Go ahead, I've got Jane down.
Do a full assessment, and we will staff it later.
Thanks. You good?
I'm good.
Welcome back.
Don't open the box. No, open the box. No, don't open the box. Back and forth. The fingers you can count. The count likes to laugh, and he's just a puppet. Sometimes I feel like a puppet with someone operating me.
I'm Dr. Reese. Can you tell me your name?
On me, because surgery belongs in another part of the hospital. Each part separated by a floor made of marble or wood.
Can you tell me how you got here?
Cooking things through at a slow heat. The temperature cooks evenly through me to the core of my eyes and my brain, and none of it will stop. Watching the whirring, go, 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 go. Foot, left, right, back and forth, on and off, back and forth, on and off. The switch, the light switch, breaking.
Meds first, talk later. Please, let's get her risperidol, M-tab, 2 milligrams. Should calm her down. All right?
I don't know why I let you talk me out of coming here.
So catch me up on Jane Doe.
No idea on her. Maggie is working with PD to get a name. Talk screen is clean. This isn't drug-induced. I'm thinking bipolar mania, rapid speech, psychomotor agitation, flight of ideas, plus she hasn't bathed in days.
So presumably she went manic and fled wherever she was living? Mm-hmm. You started her on Risperdal.
It hasn't made a dent. I want to double the dose and add a second mood stabilizer.
You ruled out all other possibilities. Schizoaffective disorder, temporal lobe epilepsy, delirium, other mood disorders.
Why? Mania can be diagnosed through pattern recognition, just like I've done, and there's been no clinical indication to keep digging for anything else.
Just humor me, okay, doctor? Look, it's your first day back. Before you add any other meds, just check all the boxes, even if you don't think it's necessary. Physical, neuro exam, motor function, head CT, all that stuff. Okay?
Okay.
Okay, good.
Oh, Dr. Charles. Our Jane Doe is Jamie Walker, an aspiring chef in culinary school.
Huh.
A month ago, she started staying up all night, reading the Bible and writing a manifesto. Last week, she dropped out of school and hasn't been seen home in 4 days. Now, my original findings, combined with her sudden onset drop, lack in functioning, her decreased need for sleep, her grandiose thinking combined with hyper-religiosity, it is what I thought, bipolar mania.
So exams, lab results, didn't poke any holes?
No, I never got to them. I filled in the blanks without a history.
Wait, so you got all that? A detailed chronological history from a patient in a manic state?
Well, no, it came from collateral I found and spoke with her sister, Melissa.
Dr. Reese, I thought that we were checking all the boxes. You know, doing it by the book?
I confirm my diagnosis. Doesn't matter how I got there.
Yes. When you're on probation, it does. It doesn't matter how you got there.
You're right. Okay.
So what's the next move for your patient?
I want to admit her to the psych ward. She hasn't responded to any of her meds.
And what meds would those be?
I doubled the Risperdal and added Depakote, also without filling you in.
Okay. Well, you know, with bipolar, all those meds should have made some kind of dent, so I'd like to take a look.
The cancer metastasis.
Hi, I'm Dr. Charles.
4 days ago, we could have somewhat of a conversation, and now I don't know if she's eaten. Between her work and school, I thought Jamie was just stressed. I didn't realize she was having a breakdown.
None of this is on you. Jamie? I'd like to examine you now. Would that be all right?
Locked up inside. Wanted everything for it. Everything. So much my arms can't even hold them all. Flexing.
Clear, prominent disinhibition hasn't let up since my first exam, consistent with bipolar mania.
Let me go.
You see this?
Let me go. I'm not
Your
enough. Not
eyes?
enough if I gather
What?
today and all and
The
yesterday.
yellowish-brown circles around her irises. I think they're Kaiser Fleischer rings.
And weeks, days and weeks, flipping in the calendar. The bright light burns the trees, leaves falling. Stop falling. Too many people crowding. Too many people. Bright light burns the trees, leaves falling. Too many people. Too many people. Too
Your sister is in culinary school. Has she ever said anything to you about copper, using copper pots?
Yeah, I think so. Something about them being the best heat conductors? I don't know anything about cooking. Does that mean something to you?
Dr. Reese?
Wilson's disease.
What's that?
It's a genetic disorder where copper accumulates in the body. Jamie's use of copper cookware could have accelerated the buildup that led to this manic episode.
If this is Wilson's disease, is there a cure?
No, but there is treatment to manage it, and she would get better.
Oh, thank God.
Dr. Reese, could I just have a word outside? Thank you. So, you couldn't even get close enough to your patient to examine her eyes?
She was so agitated.
Dr. Reese.
I did my 2-week suspension. I am in therapy. I am not supposed to be afraid anymore. I'm a psychiatrist. Rule number 1 is to connect with your patients, and I could not even look her in the eye.
Look, the good news is that you recognize the problem, right? Sarah, nobody learns how to master their fears in 2 weeks. Trust me, it just doesn't happen. Not even somebody as determined as you are.
Okay. You know, when Allison died today, I saw myself because she could not change. But I have to. I just don't know how. You have to help me, Dr. Charles.
Of course. Of course I will.
Okay.